Wish you all a very good day. Thank you, RCOG, for giving me this wonderful opportunity. I'm Dr. Shashwati Sen, consultant obstetrician and gynecologist at Mohak Hospital, Prayagraj, India. I'm presenting a report on the topic, human immunoglobulin and aspirin can improve the obstetric outcome in sarcoidosis pregnancy. My co-authors in this study are Dr. Harish Srivastava and Dr. Gautam Sen. Now, sarcoidosis in pregnancy has an unpredictable clinical course, and with an estimate of only 0.02 to 0.05% of such pregnancies, it is challenging to have a large prospective study of disease progression and management. Corticosteroid therapy is itself associated with a slightly increased risk of cleft lip with or without cleft palate. It is also difficult to establish whether the adverse obstetric outcomes that we encounter are because of the disease itself or because of the corticosteroid treatment. Our aim is to highlight the role of human immunoglobulin and aspirin in reducing the risk of disease flare-up and also the need for corticosteroids in sarcoidosis pregnancy, leading to an improved maternal and fetal outcome. We had a 32-year-old fourth gravida with a past history of 3 recurrent miscarriages, presenting to the antenatal clinic soon after missing her periods. 7 years ago, she was diagnosed with sarcoidosis in view of characteristic clinical radiological features confirmed by epithelioid cell granuloma on histopathology. All investigations, including those for recurrent pregnancy loss, were normal. She was started on human immunoglobulin once every 3 weeks from first trimester onwards. Aspirin 150 milligrams was added from 12 weeks gestation. She was on regular follow-up and was told to inform if she developed breathing difficulties, cough, or fever. Fetal growth was monitored with 4 weekly growth scans. At 36 weeks gestation, cesarean section is performed for preterm labor with breech presentation. A healthy baby of 3.1 kgs was delivered with normal Apgar score. The postoperative period was uneventful and the mother and baby were discharged in satisfactory condition. The patient was on monthly follow-up for 6 months and no exacerbations were reported. Now, sarcoidosis is a multi-system inflammatory disease of unknown etiology, primarily affecting lungs and lymph nodes. Pregnancy being a pro-inflammatory state, concomitant sarcoidosis can exaggerate the disease manifestation and increase the risk of adverse outcomes like miscarriage, preeclampsia, eclampsia, deep vein thrombosis, pulmonary embolism, preterm delivery, and postpartum hemorrhage. Recent reports suggest a possible autoimmune origin of the disease. Human immunoglobulin can help to suppress the immunogenic susceptibility and prevent flare-ups in the presence of trigger factors like infection and other environmental influences. Aspirin has a protective role in pregnancy-related vascular diseases like preeclampsia and intrauterine growth restriction and may help to prevent the risk of thromboembolic events in sarcoidosis pregnancy. So to conclude, human immunoglobulin and aspirin can reduce the risk of disease flare-up in sarcoidosis pregnancy and improve maternal and fetal outcome. Thank you so much.